steroids. Hey everyone, and welcome back to my channel for all things mommy, wife, and life. My name is Chessa. In today's video, I'm going to be taking you through my 27 and 28 week pregnancy update. I am currently 29 weeks with baby number 2, and it is another girl. I currently have a 4-year-old daughter. If you're new here, hi and welcome. I would love for you to be a part of my YouTube family. I post motherhood and lifestyle content once a week, so if that's something you'd be interested in, I would love it if you'd hit that red subscribe button and give this video a thumbs up. And if you are currently subscribed, thank you so much. I truly do appreciate you guys. So week 27 wasn't that much different than week 26. I still have tons of heartburn. I am able to subside it a little bit with some heartburn tea. If you haven't already seen my pregnancy hacks video, check that out because I share a bunch of different hacks in that video, including how I get rid of my heartburn. I have started to see like little spots every now and again. I talked with my doctor and she said that that's perfectly normal, but if they start to like show up and then not go away, that could actually be a sign of preeclampsia. So she kind of told me just to keep an eye on it and just let her know if it persists, because that could be a sign of like high blood pressure and preeclampsia, which is not good. They did say that my blood pressure is looking fine. I didn't start getting high blood pressure with my first daughter until like the last week of my pregnancy, so I'm not super worried about high blood pressure. So I have noticed after I eat big meals, I start getting really thirsty, and then I kind of like can't catch my breath and I kind of get a little bit of anxiety. Basically what I do to combat this is just kind of sit down, drink some water, and then just take some deep breaths, and it usually goes away within a few minutes. I also feel like being on my feet for a long period of time is definitely taking a toll, especially if I'm not wearing the correct shoes. I even notice that if I'm just walking around my house barefoot, like doing housework or unloading the dishwasher, that my back starts getting super sore. So I have to just make sure that I wear some kind of supportive shoe no matter what, so that way my back isn't hurting as much. So week 28, I had my glucose appointment. My doctor discussed all of my test results from previous lab work, which was nice, and she said that everything was normal. She listened to baby's heartbeat and it was about 135, which I was kind of surprised with because usually with girls it's a lot higher. So I was actually kind of surprised that this one was a little bit lower. So after that appointment, I had my glucose test, which is basically they send you down to the lab and they draw your blood once. Then you drink a really sugary drink, and then they draw your blood again after an hour. During COVID, I actually have seen a lot of girls that were able to take their drink home with them and then drink it before their appointment, and they didn't let me do that. They actually made me sit there and drink it in front of them, and then they have to document the time that I finished with it, and you have to finish the drink within 5 minutes. I had an orange drink this time, and it really wasn't that bad. It just kind of tasted like I was drinking like an orange soda, a really flat orange soda, and I had to like chug it, which kind of, it's really sweet, especially if you're not into drinking sodas a lot, but it really wasn't that bad. They said I could go wait in my car for an hour. Last time I took this test, they made me take the 3-hour one even before I like didn't pass the first one. They just automatically gave me the 3-hour test, and then they made me stay there for 3 hours. I wasn't even allowed to sit in my car. I had to basically stand for 3 hours because they had absolutely no seating, and this was like 4 years ago. But they wouldn't let me leave, they wouldn't let me sit in my car, and I had to be there for 3 hours. So this one was much easier. I was able to just sit in my car and relax for an hour and then just come back and get my blood drawn again. And I got the results back on that test and they said that everything looked normal. However, my other blood work came back and she did say that I was slightly anemic. So she recommended that I take an iron supplement twice a day, and then she recommended that I pair that with a vitamin C supplement to help the iron absorption. She also did mention that you can kind of get constipated from that, so she said just keep an eye on that, and if that happens, then I can take some kind of like stool softener or something like that. TMI, I know. She did say that having low iron is completely normal in pregnant women, but she said that it's something that you do need to monitor and you do need to supplement, because otherwise you could have low milk production and you could have a lot of other issues if you're too low in iron. So it's really important that you take an iron supplement if you're anemic. And I also have to wait like 2 hours between taking the iron supplement and taking my prenatal vitamin, because the calcium in the prenatal vitamin can counteract the absorption of the iron pill. So it's a whole big thing on how I have to like time out my pill taking. And then she said that she wants me to come back in another month and check my iron levels again just to make sure that everything's fine. So the other day I took like about a 30-minute walk with my dog, and it wasn't anything too vigorous. It was just like a normal walk. I wasn't like overexerting myself or anything. But then I noticed that day after I took that walk, I noticed that I got some really big cramps in my side. And I don't know if it was because that week I stopped eating bananas. We like ran out of bananas, and normally I would have a banana and cereal every morning. And since I stopped eating the bananas, I was wondering if that actually played a role in all of the cramping that I was getting, because I got so much cramping. But it was only after that walk. So I don't know if I either overexerted myself or if I just needed to eat more bananas, because since I started eating bananas again, I haven't been getting those cramps. Not sure what the distinction is there, but that was a fun side effect because that really hurt. I noticed that when I wake up in the middle of the night to pee, that I am just so thirsty and my mouth is just so dry. And sometimes it's even hard for me to get back to sleep because my mouth is just so dry. I have been sleeping in my daughter's bed lately because she gets so freaked out if she wakes up by herself. So I've kind of been just sleeping with her in her room, and my humidifier is in my other room, so that might also play a role. So it's kind of a vicious circle where I just pee and then drink water and then pee and then drink water like all night long. So getting sleep is a lot of fun. So according to the Bump app, at week 27, baby is 1.93 pounds. Sorry, I'm looking down because that's where I have my information. And baby is as big as lettuce. So I don't know, like, yay big. I'm just gonna go over some of the symptoms that they say could be happening. I'm gonna let you know if I am experiencing the same things that's on the list. So leg cramps, not so much leg cramps, but as I did mention, I did get those cramps like kind of like in the side after exercise. And I do exercise a little bit in the morning and I don't get cramps during the day, but it was just after that like one time. Backaches, yes, definitely my lower back, but even my shoulders can start getting a little bit tight. Constipation, not really. I've been kind of smooth sailing in that department. That might change after this week because I have started taking those iron pills, but they did say that constipation is a side effect of that, but I'll keep you posted next time. So far, we're all good. Hemorrhoids, no, I have not had the pleasure yet. So I hear that that is definitely a thing, and I feel for those who have those, but I can't say that I do. Skin, hair, and nail changes. I have noticed that my hair is very dry. My skin, I don't really feel like I'm glowing. I am obviously wearing makeup right now. I feel like my skin is kind of like patchy. I almost feel like I'm getting some of that, what's it called, melasma, kind of at the like top of my head. So I have been wearing sunscreen to try to prevent that, and I've been putting a lot of serums on my face, and I also just feel very dry also because I've been like wearing masks at work and everything like that. And my nails, they're brittle. They're always kind of brittle regardless of whether or not I take a prenatal. And the last one for week 27 is sniffing, which I think is just peeing when you sneeze. I did have that a couple weeks ago just randomly, but I haven't had that since. So at week 28, baby is 14.8 inches and weighs 2.2 pounds and as big as an eggplant. So they say that right now, week 28, you're about 7 months pregnant, and I can't believe it's already like over 7 months. It's insane. It's happening so fast. I already feel absolutely huge, especially towards the end of the day. One of the side effects they said is trouble sleeping. I don't really have a lot of trouble sleeping, but like I did say, I do wake up a lot to pee, and then I just can't get back to sleep sometimes because my mouth is so dry. So that's like the only trouble sleeping I've really been having. Most of the time I don't have issues falling back to sleep. Shortness of breath, absolutely. Everything's getting pushed up into your lungs. Your lungs have less space. So I noticed I have a shortness of breath a lot quicker. Aches and pains, for sure. I get like random twinges in my hip, upper shoulder, lower back, random cramps and stuff like that. Braxton Hicks contractions, I don't think so. A couple weeks ago in my last pregnancy update, I did mention something about like feeling crampy or something, but that was gone after that day and it never came back. So I'm not sure if that's what I was experiencing, but I haven't really experienced anything like that since, so I don't know. So far, I don't think that I have Braxton Hicks contractions. And the last symptom for week 28 is leaky boobs, and I do not have that yet. I didn't start getting that towards like the end of my last month. I know some women are experiencing that already, but I have not had the pleasure yet. And that's everything for this video. Last thing, I will show you my bump, but thank you guys so much for watching. I truly do appreciate it. Make sure you give this video a thumbs up if you liked it, and I would love it if you consider subscribing to my channel. Thanks again for watching, and I'll see you guys in the next one. Bye guys.
be wrapped around your arms instead of being lonely. We could be gazing at the stars, but now it feels just like I wandered off into a room and closed the door behind me. I never gave the key to you, even though I wanted to. I should be trying something new, but now my body's aching. I'm tired of dwelling in the dark, it's just that my heart can't take it. I didn't know what it would cost me when I let you go. I feel alive.